Good evening, I'm Anthony Totri.
And I'm Annika Abbott. Our other big story tonight, the quickest growing population in the United States, Hispanics, has the lowest autism diagnosis rates. But why?
Medical experts say language barriers and semantics may be the main reason. Daria Yazmiene reports on the resources available to help families.
For one Hispanic child that receives a diagnosis, 1.6 white children received a diagnosis.
According to the Centers for Disease Control and Prevention, the prevalence of autism among Hispanics is lower than other ethnicities across the U.S. In Arizona, that number is even lower. This could be linked to a language barrier when it comes to MCAT. MCAT is the modified checklist for autism in toddlers between 16 and 30 months of age. The results could lead to an evaluation of the child. Lourdes Lerma says her daughter Nayara was not evaluated correctly.
She is 32 years old, and she was misdiagnosed, probably when she was around 4 years old. And they said that she had mild mental retardation instead of autism.
Children can be diagnosed with autism as early as 2 years old, but are most often detected around the age of 4. That was not the case for Nayara.
At that point, those many years ago, they didn't know much about autism until we found out until probably she was around in her 20s.
Lourdes says at the time she didn't have the proper tools and resources to help her daughter. Now, Lourdes and Nayara run a beauty line and are surpassing others' expectations. In Arizona, there are currently multiple organizations that provide resources for people in the Hispanic community who have autism.
It is really important to really seek those supports that are available in the state. There are organizations like SARC that could potentially support and help, not necessarily providing the services ourselves if they're not available or if they're not the right fit for that family, but we're also a resource organization that could potentially guide the families on navigating those systems that are available and they just don't know about.
According to Orr, with knowledge of available resources, more diagnoses can be made.
Even though there's not enough, but there are more resources, we are able to identify and diagnose more Hispanic children these days than it was in the past.
In Phoenix, Daria, Yazmiene, Cronkite News.
SARC and other local organizations refer resources and have programs for people starting as young as 2 throughout adulthood.